Thank you, Chairman Joyce, and to Ranking Member Clark for convening this very important hearing. Our nation's organ procurement and transplantation system requires strong coordination between federal agencies, the organ procurement and transplant network, organ procurement organizations, and hospitals. Now, the current OPTN contractor, UNOS, is based in my district. And over the years, when I was a state legislator, I had a chance to visit their office several times and hear updates about the modernization process. These conversations have taught me that there's a very complex but critically important organ transplantation system in place that depends on having the public's trust, and we agree that there is always room for improvement to better protect patients while saving lives. Now, while we are in this oversight hearing, I do want to highlight my bipartisan bill with Congressman Rob Whitman, H.R. 330, the Organ Donation Referral Improvement Act, that requires the Department of Human Services to study how automatic electronic donor referral systems can help eliminate barriers to successful organ transplantation. And this would be one step towards minimizing error and enhancing patient safety. And I appreciate today's discussion about other reforms and challenges that are needed. So I want to ask Dr. McBride, in your testimony, you emphasize UNOS's role as a contractor supporting the OPTN with 4 decades of experience. From your perspective, what are the most important reforms that we need to make to improve the organ procurement and transplantation system to better protect patients while saving as many lives as possible?
Thank you, Congresswoman, and thank you for the support of the automated donor referral bill. We really appreciate it. There are many reforms that we have discussed, and we have discussed some of them today. I think based on the topic of this hearing, the most important one is to create a reporting system where patients, members of the healthcare community can provide information about potential wrongdoing for their loved one or their family member. The fact that it took 3 years for the index case, as it's been referred to come to light is unacceptable, and I hope that this Congress will push HRSA and CMS to create a system that can be available to all patients and families to make it easy for them to make these kinds of conversations public so that it can be forwarded to the right oversight body to be addressed.
Thank you, and I like Dr. Formica's words of wisdom to come with solutions, so I'm trying to give you all an opportunity to do that. But for Dr. McBride, how can the OPTN improve oversight of OPOs to prevent the tragic situations that were discussed today?
I think piggybacking off of Dr. Formica's comments, there is a split in the oversight of the organ donation and transplant system. So CMS has oversight over hospitals, and the OPTN has oversight under HRSA of the transplant hospitals, the OPOs, and the histocompatibility labs. That split in oversight does leave room for communication gaps and opportunities for further improvement. So I do think consolidation of the entire transplant ecosystem under a single government regulatory body could provide benefits to the transplant community.
And are there any other resources or authorities that we would need to provide to accomplish that?
I believe Congress has the authority to do that.
Okay. And Dr. Formica, I don't know if there's anything you'd like to add on to that.
Yeah, I'll just echo that. As a program director, I prepare for an OPTN audit every 3 years and a CMS audit every 5 years, and they don't cover the same topics. So.
Okay. And in the 55 seconds I have left, Dr. Massa or Dr. McGee, if there's anything else you would like to add on what you think Congress could do either in your answer now or that you would like to provide on the record, I do want to give you all an opportunity, and it's probably going to have to be in writing on the record later. I want to give each of you the opportunity from your perspective to say what changes need to be made and that recognizes the complexity of this process and how we have 3 different systems working together, whether it's the hospital, whether it's the procurement organization or UNOS, and they all have different governing structures and different things in places, and things fall through the cracks. So if you could provide us from your perspective, everything you think Congress needs to do to prevent these tragedies from happening. I appreciate it. Thank you. Yield back.
The general